Our body is capable of responding to changes in blood pressure so that it keeps the blood pressure within a normal range. So if the blood pressure is decreased, there are two ways by which our body can return it back to normal. One is using the autonomic nervous system. The other one is using the angiotensin, the renin-angiotensin-aldosterone pathway. I will first describe the autonomic system. So when there's decreased blood pressure, there's increased sympathetic activation, and that increase is proportional to how much blood pressure has decreased. So the lower your blood pressure, the greater the activation of the sympathetic nervous system. The sympathetic nervous system, when it's activated, it causes four things. It causes venoconstriction, increased contractility, increased heart rate, and vasoconstriction. Venoconstriction means constriction of the veins. When the veins constrict, two things happen. One is that venous compliance decreases. And we saw here that a decrease in venous compliance increases venous return. Okay? So there's decrease in venous compliance increases venous return to the heart. The second thing that will happen is that venoconstriction shifts the blood to the arterial high pressure system. Okay? So now you have more blood on the arterial side of the circulation. Increased contractility means that the heart contracts more forcefully. So when the heart contracts more forcefully, it's going to decrease end systolic volume. Now a decrease in end systolic volume is going to increase stroke volume. Together, venoconstriction and increased contractility are going to increase stroke volume, because venoconstriction causes increased venous return to the heart and therefore increases end diastolic volume. Increased contractility causes the heart to contract more forcefully and therefore decreases end systolic volume, and we know that an increase in end diastolic volume plus a decrease in end systolic volume equals increased stroke volume. So by increasing stroke volume, we increase cardiac output. Third is an increase in heart rate. We know from the equation cardiac output equals stroke volume times heart rate that when either stroke volume or heart rate increases, cardiac output increases. So here we have increased heart rate as well as increased stroke volume due to venoconstriction and increased contractility. So an increased stroke volume and an increased heart rate together greatly increase cardiac output. Finally, there is the vasoconstriction, which is constriction of the resistance arteries. And constriction of the resistance arteries is going to cause an increase in total peripheral resistance within the arterial high pressure system. So together, an increase in cardiac output and an increase in total peripheral resistance is going to increase the mean arterial blood pressure. So as you can see in this diagram, we have the heart, venous system, and arterial system. Initially, there is more blood within the venous system than the arterial system. When blood pressure drops, we have venoconstriction. So the veins constrict, as you can see here, becomes narrower, and that diverts blood from the venous system to the arterial system, so the arterial system expands as it receives more blood. But then we also cause vasoconstriction. So we're going to constrict these arterioles. We're going to constrict the arterial system, as shown here. So what you see is that the arterial system not only receives more blood because of the constriction of the veins, but at the same time it constricts into a smaller diameter. So now you have more blood volume within a smaller diameter tube. So there's very high pressure within the arterial system, and that in turn causes increased blood pressure, because the blood pressure represents the blood pressure within the arterial system, not the venous system. That is why it is called mean arterial blood pressure on the arterial side. We are not concerned with the pressure within the veins, we're concerned with the pressure within the arteries. We want to make sure that the pressure within the arterial system is kept within a normal range so that blood flow to the tissues remains normal. You can also help increase blood pressure by elevating the legs, because we know that the veins store a lot of blood. Most of the blood is stored within the veins at rest. So when we elevate the legs, we allow gravity to pull all of that blood within the veins and return it to the heart. And therefore we are increasing venous return to the heart. and we said that increased venous return to the heart causes increase in end diastolic volume, and therefore increased stroke volume, increased cardiac output, and increased mean arterial blood pressure. Another way by which the body will help increase blood pressure is by using the renin-angiotensin-aldosterone pathway. When blood pressure decreases, kidneys will release renin, which is going to be converted to angiotensin 1 and then to angiotensin 2. Angiotensin 2 can directly cause vasoconstriction and venoconstriction. Okay? Second, angiotensin 2 causes the release of vasopressin from the posterior hypothalamus. Vasopressin is an antidiuretic hormone that causes reabsorption of water from the kidneys. So the kidneys reabsorb as much water as they can to prevent water from being excreted in urine, because our blood volume is low, so we do not want to lose any more fluid. Furthermore, angiotensin 2 causes the release of aldosterone from adrenal cortex. Aldosterone causes the kidneys to reabsorb sodium at the expense of excreting potassium, therefore increasing plasma sodium concentration. An increase in plasma sodium concentration causes an osmotic retention of fluid within the plasma, into the plasma, so that there is more fluid held within the blood, therefore preventing the blood volume from decreasing. The problem with the bioreflex response is that when there's significant blood loss, there's a very strong sympathetic activation, and that is going to cause significant cutaneous vasoconstriction, because blood has to be diverted away from the skin and to more important organs such as the brain. Skin is not important for the body when blood volume is low, so blood is diverted away from the skin, so the skin becomes very pale and also cold, because blood carries heat. So if there's less blood flow to the skin becomes pale and cold. Furthermore, a very strong sympathetic activation is going to cause the person to sweat, because sympathetic nervous system innervates the sweat glands. So when there's a very strong sympathetic activation, the sweat glands are activated and you sweat. So the major symptoms of a decreased blood volume and therefore blood pressure are pale skin with cold extremities and cold sweat. Again, all symptoms caused by decreased blood flow to the skin. Now, if blood volume continues to decrease and therefore blood pressure continues to decrease, then blood is also going to be diverted from other organs such as the digestive and urinary organs. Now, if there is decreased blood flow to a tissue over a long period of time, that tissue is going to begin to get damaged from ischemia. So if you have a decreased blood flow to the kidneys as well as the skin for a long period of time, then you will get ulcerative damages to the skin and even kidney failure. You will also get other form of damages to the organs of the digestive system. And these are all permanent, so that even after you get blood transfusion and return blood pressure back to normal, your kidney and the skin and other organs will remain damaged and therefore will not recover.